You're experiencing anxiety, PMDD, postpartum issues, issues with sleeping, issues with focus, and you're looking on the internet and you're coming across this idea of mineral imbalances. And you discover that copper and zinc are really important when it comes to mental health. And you think to yourself, what do I do? How do I fix this? Where do I start? And that's what I'm going to cover in this video today. My name is Dr. Allie McLean. I am a licensed naturopathic doctor. I focus on mental health, gut health, and hormonal health in my practice, and I primarily work with women. So first I want to define what copper is. Copper is a mineral. It is essential. It exists in our body. It is necessary for multiple things, including red blood cells and collagen production. It does so many things in our body. So it's not like we want to get rid of all copper, obviously. If that wasn't obvious, now it is. But what we do want to do is balance copper in our body. So if copper is in excess, especially in relationship to zinc, that's when we start to have issues. Now, copper and zinc do exist in a harmonious balance, and we know that giving zinc actually increases something called metallothionein in the gut, which will help excrete copper. But copper and zinc need to be looked at separately. We can't just assess copper and assume that we have a zinc issue. We also need to test zinc. Zinc is also an essential mineral. So with copper, the way that it impacts your mental health when it is in excess, the first concept that you have to understand is the concept of excess free copper. This refers to the percentage of copper in your blood that is not bound to a protein that is made in your liver called ceruloplasmin. Ceruloplasmin is a specifically copper binding protein. If you do not have enough ceruloplasmin binding to copper, then what you have is an elevated percentage of free copper. When you have an elevated percentage of free copper in your blood, copper becomes oxidative. Copper promotes oxidative stress in the brain and in the body, and that's where we start to see issues. From the biochemical standpoint, copper is a cofactor for the conversion of dopamine to norepinephrine. So dopamine is the brain chemical that keeps you focused. It's reward-based. It tends to be lower in people with ADHD. Norepinephrine is downstream of dopamine, and norepinephrine is synonymous to adrenaline. It's like the adrenaline in your brain. It's that fight or flight surging feeling that a lot of people are experiencing. So one reason to assess for copper toxicity is if you're having anxiety that's presenting as adrenaline surges. So what does that look like? It's a very physiologic anxiety. So heart palpitations, feeling like a surge of adrenaline in your body, feeling like you literally have to get up and run. People who experience copper toxicity to the fullest extent really start to feel this in their brain. And there's no amount of nervous system regulation, of breath work, of cold plunging, of whatever that you can do if you are copper toxic. You're going to have a dysregulated nervous system because the copper is converting that dopamine to norepinephrine. And while you're being depleted of dopamine, it can worsen ADHD symptoms. So ADHD symptoms like trouble focusing or trouble initiating tasks or issues with everyday executive functioning. So if you're having any of those symptoms, anxiety, executive functioning issues, it's a great reason to get tested for copper. Copper toxicity can also show up in women who have estrogen dominance because copper and estrogen go hand in hand. So when a woman is pregnant and she's growing a fetus, estrogen increases because estrogen is an anabolic hormone. So the more estrogen we have, the more tissues are going to grow. We also need a blood supply. So that blood supply requires new vessels to be made, right? Those vessels have to be recruited to the growing tissue. And part of what makes up blood vessels is collagen. And part of what makes up collagen is copper. So when women are pregnant, their copper goes up and their estrogen goes up. And the copper is going up in response to the estrogen because of the angiogenesis. So oftentimes what happens is when women are pregnant, once they give birth and they're in that postpartum period, their copper levels should fall back to baseline, but sometimes they don't fall back to the baseline that they were at before they were pregnant, and now they're here. They're at a new baseline. So now we have an issue with a higher baseline of copper in the body, and postpartum anxiety is a really big problem in a lot of women. And I'm not saying that copper toxicity is the only reason that it occurs, and I'm not saying that even if a woman does have copper toxicity and she has postpartum anxiety, that is the place that you stop the investigation and that's the sole reason. But it certainly contributes to it. And addressing these biochemical imbalances can really make a huge difference. So let's talk about how to assess for copper toxicity. Let's talk about what it looks like when you're testing in the labs. So the first thing I want to say right off the bat is that copper needs to be assessed in the blood. We do not test for copper via a hair test. A hair test is going to give us an average of minerals that are coming out over the course of a 3-month period. And it's going to tell us maybe what's more accessible to your cells. But hair tests are really not a reliable test in a lot of ways, especially for copper, because we want to know what's floating around in your blood. We want to know what's impacting your brain right now. Hair is also essentially head poop. It's what's getting excreted from you. It looks nice, but it's actually detoxing, right? So if you have high levels of copper in your hair, that could also just be a sign that your body's doing a good job of getting rid of copper. So we really don't know if copper is a problem unless we test it in the blood. So when I test copper in the blood, I do 3 tests, because the third one I do looks at zinc, because that's important. So plasma zinc is one of them. The second one is serum copper, and the third one is ceruloplasmin. Serum copper is really important to look at in relation to the ceruloplasmin, because with those 2 numbers, we can calculate a percent free copper. Once we get a percent free copper, then we can understand whether the person is dealing with copper excess in terms of the percent free copper, or if they're dealing with copper overload altogether. So the person might be dealing with an elevated percentage of free copper and high copper, or they might just be dealing with an elevated percentage of free copper, but the copper itself is not high. And the reason that's important is because the treatment looks a little bit different. The other thing we want to look at is zinc. So plasma zinc will tell me what somebody's blood levels of zinc are looking like. If someone's blood levels of zinc are relatively on the higher end, because we can overdo it with zinc, but they also have high free copper, I'm probably not going to give them zinc because that's not safe. But 9 times out of 10, what happens is I see somebody who has high copper and low zinc. So I address the zinc and I address the copper, but they are 2 separate issues. So you don't just assume that because you have high copper on a hair test that you need zinc. You want to test it in the blood, and you also want to test zinc in the blood. And from there, you can make a clinical decision on what to do and how to approach it. So remember I said that copper is oxidative. So it creates oxidative stress in the body. So what do we need if we have oxidative stress? We need antioxidants. So part of the treatment for copper toxicity are antioxidants. The other part of it is addressing low zinc if the zinc is low, and then also molybdenum is a really important mineral as well that will help. But too much too fast can create more detox symptoms because it can push copper dumping, which we don't want. Copper often presents with high estrogen symptoms, like I just mentioned, pregnancy, but another one would be a woman who has fibroids in their uterus or fibrocystic breasts, anything that indicates high levels of estrogen. If you take birth control pills, so synthetic estrogen, that can increase copper. Also, bioidentical estrogen can increase copper. So maybe you're a woman who's peri or postmenopausal and you started getting these symptoms, these histamine symptoms. There's crossover there between the histamine and the copper. So if estrogen is high, we want to look at what's going on in the liver and in the gut. If your liver is backed up, if you have sluggish bile flow, cholestasis, you're not detoxing estrogen properly, we want to support estrogen clearance, making sure that the gut is in the right shape to get the excess estrogen out. If it's not an intake issue in terms of xenoestrogens from plastics and products, or birth control pills or something that they're putting in their body, then it's an excretion issue. Progesterone balance is a separate thing that is relevant, but in this particular case, I'm talking about estrogen overall being high, regardless of what progesterone is doing. So dysbiosis leads to elevated beta-glucuronidase, which is an enzyme that will deconjugate estrogen and make estrogen go back up into the liver, and your body can't get rid of the estrogen at that point. So we want to address dysbiosis. So what is causing the elevated beta-glucuronidase is dysbiotic bacteria. So I like to assess the gut very thoroughly. I do small bowel assessment and large bowel assessment. Small bowel assessment being breath testing for SIBO, large bowel assessment being either a 16S RNA test or a shotgun sequencing test. And both of those are stool tests. And those give me really good information about what your microbiome is doing because they sequence your entire microbiome. So I can see what specific targeted prebiotics your microbiome needs, and maybe antimicrobials if it's indicated, if you do have an overgrowth of bacteria that would reduce in population in response to targeted antimicrobials, not antimicrobials that annihilate your entire microbiome, like high-dose berberine over a long period of time or grapefruit seed extract. I'm talking antimicrobials that are more gentle on your microbiome, but also start to regulate things. And I never use them without using prebiotics at the same time because there's a synergistic effect, and we always want to feed while we're killing. We don't just want to kill. And a lot of people will do the gut thing wrong because they'll start off by doing a PCR test. You're already moving in the wrong direction with that because you're not looking at the overall health of your microbiome. And then on top of that, once you do the PCR test, you're like, oh, look, all these things are red and they're lit up. Let me just boom, 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 hit it with a bunch of antimicrobials with little focus on how are we actually feeding the beneficial bacteria. And beyond how are we feeding the beneficial bacteria with supplements and targeted prebiotics, how are we feeding it with diet? How are we feeding our microbiome with diet? What are we eating, right? So this also comes into play with estrogen dominance, which will affect copper toxicity. Now, copper toxicity is a multifaceted issue. It is not just, oh, I have high copper, so I'm going to take zinc. No, remember I said you want to assess zinc separately from copper. But if you're somebody who is having ADHD symptoms, or you have ADHD, you've been diagnosed with ADHD, just because you have that kind of neuroatypical brain, it doesn't mean that you have to struggle to function. You can get it to a point where it's manageable and where you're not flaring and you're not feeling worse all of the time. So if you have uncontrolled ADHD symptoms, if you have estrogen dominant symptoms, fibroids, fibrocystic breasts, heavy periods, painful periods, histamine symptoms, because histamine goes alongside estrogen. So typically the women that I see that have high histamine symptoms also have high estrogen. So histamine symptoms looking like migraines, excessive painful periods because histamine can increase pain, allergic symptoms, anxiety, insomnia, all of that is associated with histamine. Also, if you are dealing with anxiety postpartum or just generalized anxiety, especially if it's feeling like it's a surge of adrenaline in your body, if you have heart palpitations, that is a very clear sign that you would want to look into copper toxicity. Another one would be iron deficiency, because not getting enough oxygen to your cells can also lead to heart palpitations. So I'm going to talk about a case of a woman that I saw a while back who was working with somebody who was treating her for copper toxicity, but not in the way that I do. And they were giving her beef liver supplements. So the last thing you want to do if you have copper toxicity is take more copper into your body. Beef liver supplements, not only are they really high in vitamin A, which is a fat-soluble vitamin and can be very toxic to your liver in excess amounts. If somebody is taking high-dose vitamin A from liver supplements and they're taking that high copper dose, then what do you think is going to happen to them over time? Now, this person was very convinced because the previous practitioner she had worked with was like, this is going to help your copper issues. You're going to feel better, because she also had low ferritin, and copper and iron have a relationship, which is a separate conversation. But essentially, copper and iron will compete. So if you have low iron and you have high copper, you don't need more copper, you need more iron. And why the iron is low doesn't just mean take a supplement. I have another video on that, so you can watch it in terms of what is causing low iron, but that needs to be assessed separately. It's not just take a beef liver supplement for the low iron. That doesn't actually make sense. So this woman was taking this and she felt better initially, and this is what I hear often. They start taking the beef liver supplement, they have all this energy, because what does it do when you put something in the body that's already in excess? It puts things into storage. So it takes the copper in the blood and it puts it into storage. But over time, you start to saturate those tissues with the copper, and then it starts getting dumped out. It starts getting dumped out in the bile, and you start having those worsening symptoms of copper toxicity. And she was having all the symptoms: insomnia, heart palpitations. She was so convinced that this was the thing for her to do, because of the ideologies that are spread from the Ray Peat community. People are very convinced, and there are entire support groups of people who have done this and then they have got worse. So that was the case for her. I told her to stop taking it. We assessed her copper. It was sky high. She had really high free copper percentage. She also needed zinc. Her zinc was low, and we slowly started to build her up. Once she stopped the supplement, immediately she was already feeling a lot better. And then addressing the zinc deficiency and the copper toxicity and the oxidative stress associated with that really helped her. Her anxiety went down significantly. Her energy went up. Her sleep got better. So it was a great outcome for her, and it really just comes back to understanding copper and zinc and iron and how to go about it in the right way versus how to do it the wrong way. And unfortunately, there's a lot of circulating information of people who are not doing it the right way, and people are suffering. So that's why I'm making this video. So if you are somebody who has been exposed to some of these other methodologies and you're not feeling better, just know that you probably went about it the wrong way. Okay, I hope this was helpful. If you have any questions, put them in the comments and I will be happy to answer them. None of this is intended to be medical advice. If you do want to work with me, the link to my website is below. Please be sure to like and subscribe. Thank you so much.